What is the primary purpose of the decontamination area in a central service department? A. To inspect and package instruments. B. To store sterile supplies. C. To remove soil and contaminants from instruments. D. To sterilize finished trays. Answer: C. The decontamination area is where instruments and medical devices are first received after use. This area is designed to safely remove soil, blood, and contaminants before items proceed to inspection and sterilization. Proper cleaning in this step prevents cross-contamination and ensures effective sterilization later. Which disinfectant is most effective against bacterial spores? A. Alcohol. B. Chlorine compounds. C. Phenolics. D. Hydrogen peroxide plasma. Answer: B. Chlorine-based disinfectants are known for their broad-spectrum effectiveness, including activity against bacterial spores. While alcohol and phenolics are common for surface disinfection, they do not reliably kill spores. Sporicidal agents are essential in areas where contamination risks are higher. What is the recommended water temperature range for manual instrument washing? A. 40 to 50 degrees Fahrenheit. B. 60 to 80 degrees Fahrenheit. C. 80 to 110 degrees Fahrenheit. D. 120 to 140 degrees Fahrenheit. Answer: C. Water that is too cold does not effectively remove soil, while water that is too hot may cause proteins to coagulate and adhere to instruments. The recommended temperature range of 80 to 110 degrees Fahrenheit ensures soil is loosened without setting contaminants into the metal. Which instrument requires insulation testing after cleaning? A. Scissors. B. Laparoscopic instruments. C. Hemostats. D. Forceps. Answer: B. Laparoscopic instruments are electrically powered and require insulation to prevent burns or injuries during procedures. After cleaning, insulation testing confirms that the protective coating has not been damaged. This is a safety step for patient protection. Which of the following indicators verifies sterilization conditions inside a pack? A. External chemical indicator tape. B. Mechanical printout. C. Internal chemical indicator. D. Biological indicator from another load. Answer: C. Internal chemical indicators are placed inside a pack to verify that sterilization conditions reach the interior of the load. External tape shows exposure, and biological indicators test for spore kill, but only an internal indicator ensures penetration into the pack. Why is enzymatic detergent often used in instrument cleaning? A. It prevents rusting. B. It breaks down organic matter such as blood and tissue. C. It reduces drying time. D. It lubricates hinges. Answer: B. Enzymatic detergents contain enzymes that break down blood, tissue, and other organic soils, making them easier to remove. This is especially important in cleaning complex instruments with lumens or joints where debris can hide. Which of the following is a critical parameter for steam sterilization? A. Pressure. B. Light exposure. C. Water clarity. D. Packaging type. Answer: A. Steam sterilization requires a combination of pressure, temperature, and time to ensure sterilant penetration. Pressure allows steam to reach the necessary temperature for microbial destruction. Without adequate pressure, sterilization cannot be achieved. What is the main risk of using saline for cleaning instruments? A. Promotes bacterial growth. B. Leaves a sticky residue. C. Causes pitting and corrosion. D. Extends cleaning time. Answer: C. Saline is corrosive to stainless steel instruments and can cause permanent pitting and damage. Instruments should never be soaked or cleaned with saline, as this compromises both function and sterility assurance. What is the proper placement of heavier instrument sets in a sterilizer load? A. On the top shelf. B. On the bottom shelf. C. On the middle rack. D. Next to wrapped supplies. Answer: B. Heavy sets should be placed on the bottom shelves of sterilizers. This prevents crushing lighter items and allows steam or other sterilant to circulate evenly without obstruction. What is the purpose of using a biological indicator in sterilization? A. To show exposure to sterilant. B. To confirm sterility assurance by killing resistant spores. C. To verify packaging integrity. D. To shorten sterilization cycle times. Answer: B. Biological indicators are the gold standard for sterilization monitoring because they contain highly resistant bacterial spores. A successful kill indicates that the sterilization conditions were adequate to destroy even the hardest-to-kill organisms. Why should multi-part instruments be disassembled before cleaning? A. It reduces the number of trays needed. B. It allows better sterilant penetration and cleaning. C. It prevents mixing of different instruments. D. It increases speed of the cycle. Answer: B. Disassembly ensures that all surfaces, joints, and lumens are exposed to detergents and sterilants. If left assembled, debris can remain trapped, leading to contamination risks and ineffective sterilization. Which area in central service requires the highest level of cleanliness? A. Storage room. B. Decontamination. C. Sterile processing area. D. Administrative office. Answer: C. The sterile processing area is where clean and sterile items are inspected, packaged, and stored. Maintaining the highest cleanliness standards here prevents recontamination of sterilized instruments. Which type of water is best for final instrument rinsing? A. Tap water. B. Distilled or deionized water. C. Softened water. D. Salt water. Answer: B. Distilled or deionized water is free of minerals and contaminants that can leave deposits or cause corrosion. It ensures that instruments are clean and do not carry residues into the sterilization process. Which packaging method allows the best visibility of contents? A. Muslin wrap. B. Rigid container. C. Paper plastic pouch. D. Aluminum foil. Answer: C. Paper plastic pouches provide visibility of contents while maintaining sterility. They are commonly used for small items and allow staff to identify instruments without opening the package. What should be done if a sterilizer cycle shows a failed biological indicator? A. Ignore it if the chemical indicator passed. B. Rerun the sterilizer immediately. C. Quarantine all items from that load until reprocessed. D. Only reprocess items used in critical procedures. Answer: C. A failed biological indicator means sterilization was not achieved. All items from that load must be quarantined and reprocessed to prevent patient risk. Passing chemical indicators alone are not sufficient. Which instrument is most likely to require ultrasonic cleaning? A. Scalpel blade. B. Suction tips with lumens. C. Retractor. D. Towel clamp. Answer: B. Ultrasonic cleaners use sound waves to dislodge debris in hard-to-reach areas such as lumens and serrations. Suction tips benefit greatly from this method because manual scrubbing often misses interior surfaces. Which sterilization method is best for heat-sensitive items? A. Steam sterilization. B. Ethylene oxide (ETO) gas. C. Dry heat sterilization. D. Flash sterilization. Answer: B. Ethylene oxide is a low-temperature sterilization method effective for heat and moisture-sensitive items. Steam and dry heat cannot be used on delicate materials like plastics or electronics. Why should loaner instrument sets be processed upon arrival? A. To reduce inventory count. B. To verify sterilization from the vendor. C. To ensure proper decontamination and inspection. D. To shorten patient wait times. Answer: C. Loaner instruments may carry unknown contaminants and may not have been processed according to facility standards. Processing upon arrival ensures that they meet sterility requirements before use. Which step should always follow instrument lubrication? A. Drying. B. Packaging. C. Inspection. D. Sterilization. Answer: B. After lubrication, instruments are dried and then packaged for sterilization. Lubrication ensures that moving parts function correctly during surgery, but packaging is necessary to maintain sterility until use. Which cycle is used for sterilizing unwrapped instruments for immediate use? A. Gravity cycle. B. Flash sterilization. C. Pre-vacuum cycle. D. Ethylene oxide cycle. Answer: B. Flash sterilization is a rapid steam process used for unwrapped instruments that are needed immediately. It is not intended for routine processing because items are unwrapped and therefore at higher risk of contamination. What is the main function of a Bowie-Dick test? A. To check packaging integrity. B. To verify air removal in pre-vacuum steam sterilizers. C. To confirm biological spore kill. D. To detect detergent residue. Answer: B. The Bowie-Dick test monitors air removal and steam penetration in pre-vacuum sterilizers. Proper air removal ensures that steam reaches all areas of the load for sterilization effectiveness. Which type of packaging requires drying after steam sterilization? A. Rigid containers. B. Peel pouches. C. Muslin wraps. D. Paper wraps. Answer: C. Muslin wraps absorb moisture during sterilization and require drying time. If not properly dried, wet packs can compromise sterility and lead to contamination. Why is instrument count performed before and after a procedure? A. To ensure sterilizer validation. B. To track loaner equipment. C. To prevent retained surgical items. D. To speed up turnover. Answer: C. Surgical counts protect patient safety by preventing instruments or sponges from being left inside the patient. Central service staff assist by ensuring accurate counts during assembly. What is the maximum recommended storage time for sterile packages in a controlled environment? A. Time does not matter, event-related sterility applies. B. 7 days. C. 30 days. D. 90 days. Answer: A. Sterile packages remain sterile until a contamination event occurs, such as a tear or moisture. Event-related sterility has replaced outdated fixed-time expiration dating. Which method best ensures lumen instruments are cleaned properly? A. Wiping with alcohol. B. Using pressurized water or air flush. C. Soaking in saline. D. Wrapping tightly before cleaning. Answer: B. Lumen instruments must be flushed with water or air to dislodge debris that cannot be removed by surface cleaning. This step is critical for sterilant penetration. Why is personal protective equipment, PP, essential in the decontamination area? A. To speed up workflow. B. To protect instruments from damage. C. To protect staff from infectious hazards. D. To meet packaging standards. Answer: C. PP, including gloves, gowns, and face shields, protects workers from exposure to bloodborne pathogens and chemical hazards. Decontamination areas pose the highest risk for contamination. What should be done with instruments showing rust or pitting? A. Clean with saline. B. Lubricate heavily. C. Remove from service for replacement. D. Sterilize with EDO. Answer: C. Rusted or pitted instruments compromise patient safety and cannot be properly sterilized. These items must be removed from service and replaced to prevent infection risks. Which sterilization method uses hydrogen peroxide plasma? A. Steam. B. Low-temperature gas plasma. C. Dry heat. D. Peracetic acid. Answer: B. Low-temperature hydrogen peroxide plasma sterilization is effective for delicate items that cannot tolerate heat or moisture. It leaves no toxic residue after processing. What is the role of mechanical monitoring during sterilization? A. Ensures sterility is maintained in storage. B. Provides data on time, temperature, and pressure. C. Confirms spore destruction. D. Tracks loaner instruments. Answer: B. Mechanical monitors record sterilizer cycle parameters such as time, temperature, and pressure. They provide immediate confirmation that the cycle operated within proper ranges. Which action reduces the risk of biofilm formation in instruments? A. Immediate pre-cleaning after use. B. Dry storage before washing. C. Soaking in saline overnight. D. Delaying decontamination until next shift. Answer: A. Biofilm develops quickly when blood or tissue is left on instruments. Immediate pre-cleaning helps prevent biofilm, which is extremely difficult to remove once formed. Which type of item requires a biological indicator with every load? A. Loaner instruments. B. Implantable devices. C. Non-critical items. D. Linen packs. Answer: B. Biological indicators must be used with implantable devices to ensure sterility before use. Implants pose the highest risk because they remain inside the patient. What should be done if a peel pouch shows seal separation? A. Sterilize again. B. Tape the seal. C. Discard and repackage. D. Use immediately. Answer: C. Seal separation compromises the sterile barrier. The item must be repackaged and sterilized again to ensure sterility. Tape repair is not permitted. Which factor can cause wet packs after steam sterilization? A. Low steam pressure. B. Overloading the sterilizer. C. Shorter cycle time. D. Improper packaging material. Answer: B. Overloading prevents adequate drying and airflow, leading to wet packs. Wet packs must never be used as they provide a pathway for bacteria into sterile instruments. Which documentation is required after each sterilizer cycle? A. Patient medical record number. B. Sterilizer log including cycle parameters and load contents. C. Employee clock-in times. D. Number of surgical cases completed. Answer: B. Sterilizer logs ensure traceability of instruments and provide a record of sterilization parameters. This is vital for infection control and regulatory compliance. What is the correct storage condition for sterile packages? A. Humid and warm. B. Clean, dry, and controlled environment. C. In direct sunlight. D. Near decontamination area. Answer: B. Sterile supplies must be stored in a clean, dry, and controlled environment to maintain sterility. Excessive heat, humidity, or exposure to contaminants can compromise packaging. Which chemical sterilization method is most effective for flexible endoscopes? A. Ethylene oxide. B. Hydrogen peroxide plasma. C. Peracetic acid. D. Steam under pressure. Answer: C. Peracetic acid sterilization is safe and effective for flexible endoscopes. It provides high-level disinfection or sterilization without damaging sensitive materials. What is the best method to check for cleanliness of lumen instruments? A. Use a borescope. B. Shake vigorously in water. C. Run through flash sterilization. D. Dry completely before use. Answer: A. A borescope allows visual inspection inside lumens, ensuring no debris remains. This is especially important for minimally invasive surgical instruments. Which area requires positive air pressure relative to adjacent spaces? A. Decontamination. B. Sterile storage. C. Laundry. D. Docking station. Answer: B. Sterile storage areas must have positive air pressure to prevent unfiltered air from entering. Decontamination areas, by contrast, require negative pressure to contain contaminants. Why must hinged instruments be placed in an open position during sterilization? A. To reduce cycle time. B. To allow sterilant penetration. C. To prevent rusting. D. To save tray space. Answer: B. Open positions ensure that sterilant can reach all surfaces, including hinges and serrations. Closed instruments may trap debris or prevent sterilant penetration. What is the main purpose of chemical indicator tape? A. To verify sterility of contents. B. To identify a package as processed. C. To confirm spore kill. D. To test air removal. Answer: B. External chemical indicator tape changes color after exposure to sterilization conditions, identifying the package as processed. However, it does not confirm sterility of the contents.